Thank you. It gives me great pleasure this evening to present to you one of our Nepean Blue Mountains Local Health District innovations, the Patient-Controlled Fluid Allowance Project. One of our goals is to enhance the experience of our patients, and you'll hear from one of our patients exactly how this innovation is doing just that. The aim of the project is to empower patients to understand and control their daily fluid allowance and balance, and to improve the way in which nursing staff provide education to patients. During the video, you will hear reference to Essentials of Care. This is a program that supports us to improve patient care on the wards. Please join with me in watching the short video on our Patient-Controlled Fluid Allowance Project. Thank you.
Back in '92, I was diagnosed with cardiomyopathy through a viral infection. They have got me on the waiting list at St Vincent's Hospital for a heart transplant. My heart is only functioning at 15% at the moment. If I didn't look after this fluid balance, I would blow up like a balloon and it would put more strain on your heart. I'd be in hospital a lot more.
Fluid balance is about measuring what you take in orally and what you put out. So that's basically it in a nutshell. So what you drink whilst you're in hospital, that incorporates also the intravenous fluid, and also when you have the output, that's just your urinary fluid. So it's either using a bedpan or using a bottle so the nurses can measure it. And that will let us know how much you're passing, what you're if the treatment is effective or not. 5B has been an Essentials of Care ward for the last couple of years. Part of the process of Essentials of Care is to do audits, and on our ward audits it came up that we weren't doing so well with fluid balance recording. So that kind of led to a whole gamut of investigation. So we started to do little projects to raise awareness, to educate the staff and our patients and their families as well. They
turned and explained to me the reason why to have the fluid restriction, explaining to me, as I said, like it relieves the pressure on the heart and your body because it's not swelling up with the more fluid than what it can handle. So they explained to me that this is the reason why they've got the restriction, and they gave you examples of how much fluid was in each thing. If accurate fluid balance charting isn't kept and the patient is not taught how to do this adequately, then what happens is the patients with this lack of understanding go home, often from hospital, drink too much and come back into hospital with shortness of breath and often life-threatening pulmonary edema.
They go on what we call a fluid allowance, so it can range from 800 mils in a day up to 1500 mils. And we sit down and we discuss that with the patient and ask them if they've got any problems with thirst. But we go over it quite intricately and educate the patient of how much they have to have. And we point out the pictures that Angela took and say that this is the orange juice and this is 110 mils, so they know exactly how much fluid is in each container that they're having. And we check on that fourth hourly anyway. And then the patient records that during the day. Often when patients come into hospital, the first thing they do is lose control over everything. This is giving them back a little control. Instead of nurses telling them to do something, they're actually now telling the nurses what they've had and how they've managed their fluid balance for the day. Yeah, it's a great project and the staff are really heavily involved. They actually instigate all this. They get the folders, and we've actually had patients that have been on the fluid allowance charts before and they ask for it. They go, I want to do my own again. They go, okay. We've got casual staff that come in and say, can I get that blue folder thingy so I can start the patient on their own self-fluid balance charting? And I just think it's brilliant because it's not just our ward, it's all the other wards in the hospital. They're starting to become aware of it.
The fluid intake program that they've got at Nepean, it's changed my life. It's given me a better understanding of what the functions are. And if they hadn't have explained it to me, I'd be a lot worse off than what I am now. some days, yes, it can be a bit hard because you're turning around and constantly keeping an eye on what you're doing, but it's for your health and better in the long run.